Hi, everyone, and thank you for joining us for today's edition of Placemaking Webinar Series hosted by Project for Public Spaces. We're excited to bring you this series as part of a range of talks featuring public space issues in light of COVID-19 crisis that we're currently dealing with, and we'll be offering these for free. Today is a part 2 of a conversation on when stay at home isn't an option, homelessness in public space during COVID-19. Just a couple of rules about this webinar. As participants, please go ahead and feel free to chat us questions throughout the webinar. If we're unable to get to your question today, we will go ahead and email you afterwards, probably within 24 hours after the webinar. So if everyone could show their cameras, and I will introduce you one by one. Great, so I'd like to introduce Madison, Program Director from Fountain House, Courtney Engelstein, Program Director of Community Access, Beth Diesch, Director of Community Access, and Steve Coe, who's former CEO of Community Access, Elena Madison, who's Vice President of Project for Public Spaces, who's going to be leading the conversation today, and who will allow all of you to speak a bit more about the work you're doing and who you are.
Thank you, Juliet, and welcome everybody. And thank you to our guests. We're very excited to continue our conversation, which we started last week on basically homelessness and public space during the time of COVID-19. Today, we're joined by two major organizations providing support and services for people experiencing homelessness or people who have been homeless, in also providing supportive housing, shelters, and other kinds of services to folks who are either in a precarious housing situation or even in the streets. So these are our partners and guests from Community Access and from Fountain House, New York. I'm gonna let each of the two organizations kind of introduce themselves briefly to our audiences. All I want to say at the start of this is the reason we felt we wanted to have this follow-up is because we are all working, most of us from home, from New York City, which, as you all know, is the hotspot of this COVID epidemic right now. And it's also a city that has been grappling for a long time with issues of homelessness and also with challenges in supporting people who are precarious and don't have the same access to services, housing, food, medication, medical services, and so on. So we felt it would be relevant to kind of hear from the people on the front lines about what is happening in New York City right now and how that could be relevant to other cities, but also to our common thinking as public space planners, managers, designers, and just public space advocates. So with that, I'm gonna ask, I guess maybe we can start with Elliot, since you're one person representing Fountain House. If you can briefly introduce Fountain House and kind of your mission goals, just tell us a few words so people know why you're here.
Well, Fountain House is a 71-year-old organization that focuses on recovery for adults with serious mental illness. Since the beginning of our time, we have created about 300 other clubhouses around the world in 30 different countries. A significant portion of our membership, who we call our clients, are homeless or have a history of homelessness, along with other co-occurring disorders like addiction and formerly incarcerated. So we have for many decades worked with not only the homeless here in New York, who have serious mental illness, but homeless in a variety of other contexts and regions of the world.
Thank you, Elliot. And for Steve, Beth, and Courtney, I guess if one of you can tell us a little bit more about community access.
All right, I think Steve's pointing at me, but our windows are different.
Yeah, the windows are in a different order. Go ahead.
Yeah. So community access was founded in 1974. We prioritize the values of human rights, self-determination, peer expertise, harm reduction, and recovery in all of the services that we provide. Community access has over 1,200 units of supportive housing and a variety of community-based programs, some of which include education and job training, crisis intervention services, health and wellness services, advocacy, and art programs. So we run the gamut of a lot of services, and we appreciate partnering with programs like Fountain House to better serve the program participants and tenants that we're serving.
Great. Thank you both for the brief introductions. I'm going to jump straight in. And I guess my first question, and my suggestion would be that we go in order. And obviously, if one of you has something to add, please feel free. But I'm going to start with the first question, which is a little broader and is about what is your, not your personal, but your organization's engagement and experience with the populations and the clients and the members that you serve with public space? And I mean pre-COVID.
Well, I mean, our organization started in public space. Our organization, before we ever had a building, began on the stairs of the New York Public Library back in 1948 as a place for people with mental illness and often were homeless, just getting out of state hospitals. That is, in a sense, the first Fountain House. That's where they met. That's where they organized. It was only later, a few years later, we were able to get a building in Hell's Kitchen on the same street we're on today. Since then, of course, as I said, we've expanded. But so public space is actually kind of part of our DNA in a sense, in the lack, specifically the lack of space for people with severe mental illness that may or may not be experiencing homeless, to have a space of their own, to come together and to self-organize. And I think in many places, including the city, that place has been public space, whether it's parks, Port Authority, or things like that, is places where indigenous communities, at least the people we serve, the severely mentally ill, that the ones that are homeless, that is their place. That is their living room. That is their place where they organize. And I think where we need to be doing capacity building and community building in those places. Eventually, we need to create spaces like Community Access has and Fountain House has, that is not in public space, where we can engage in services in a more thoughtful and intentional way. But I think public spaces always will be a gathering of capacity building, community, and networking for marginalized people in any urban area.
Thank you, Elliot. That makes a lot of sense to me. Steve or anyone else?
I'll jump in there and build on that. I think, you know, the importance of public space can be overstated, particularly for a lot of the communities that we work with. You know, as we've seen some public spaces disappear and need to find a place you can go without having to spend money. So it serves just a vital role. I'm the program director of the intensive mobile treatment team at Community Access. And And before COVID, as you mentioned, a significant portion of our week, if not the entire week, was spent canvassing public spaces, from public sidewalks in the Bronx or Manhattan primarily, as well as Brooklyn, and some extent Staten Island, or the insides of city hospitals and the entranceways, the waiting areas, the ERs and the CPEPs, trying to make connection and follow up with our street homeless participants who do not have phones or other good ways of connecting. We also find a lot of our participants who may have housing, but the housing might be unstable or unsafe in some way, or may have a lifetime history of homelessness that preceded that, so their lifestyle is still kind of based on the street. In the city, it can be hard to find public spaces, especially when the weather is bad and the park is a little bit less of an option, where you can really sit with people and engage. My past experience also is on one of the city's street homeless outreach, where I spent a number of years. And again, the public spaces are just so important for folks who don't have homes. Yeah.
Great, thank you.
And to tag on to Courtney.
Go ahead.
I'm sorry.
Go ahead.
Sorry, Elena. Yeah, just to tag on to Courtney, in addition to the intensive mobile treatment team that Courtney's running, I'm the program director for our shelter assertive community treatment team, and we're primarily working with single adults who have mental illness and are living in the DHS mental health shelters. But many people prefer street homelessness over shelter for a variety of reasons, and often that comes out in conversations about personal safety in the shelter environment, or just somebody's individual mental health challenges that are exacerbated by the shelter environment, which cause them to exit for street homelessness. So.
Yeah, so the issues are complex even without the current stay-at-home order and the COVID situation. Steve, did you want to add anything?
Just the two things. So the teams that were just talked about, the assertive community treatment team was really designed to reach people who are unstably housed, living in shelters, and then to connect them into, eventually connect people into housing. But you really have to build a lot of trust and have an opportunity. And so the teams kind of are out on the streets and just going where people are. As Elliot said, people go where they feel comfortable, where they feel safe. They might go to McDonald's, they might go to the Port Authority, they might go. So it's important just to send the teams there. Courtney's team really evolved out of a thing called New York City Safe. There was a lot of people that have been cycling through the jail system as well as the shelter system, and they did not, sort of be treatment resistant, which in our view had been that we just weren't trying the right things. And this program is really quite remarkable, is that you can have very small caseloads of one participant or two or three participants to one outreach worker, and figuring out, taking the time to figure out what somebody really needs, and then helping them connect with that, whatever that need is, and over time build enough trust that people will then move their lives forward. And it's been a very successful model. The city's expanding it. So there is a way. I think a lot of cities are frustrated that these people are out on the streets, but I think these two programs show that there are ways to connect with people and move people into housing.
Thank you. That's really helpful. I have one follow-up question before we jump into the meat of our conversation, which is what is happening right now. And my follow-up question is, a lot of us as public space planners, designers, public space managers often don't necessarily understand what the needs are of those populations in public space. For one thing, to many lay people, a group of people that may appear homeless may not actually be homeless, but to us, they appear homeless. So I guess my first follow-up question is, from your perspective, is there anything that we can be doing to make people more comfortable, to connect better, even if we're not the right people to connect with them? But what is it in those public spaces that could be done better on a regular day? One of the things that Elliot has mentioned in the past was like, just give us a place to be. So do you have any recommendations, any asks before we jump into the conversation about COVID?
I would say one thing is that while we focus on individuals as kind of direct service, social service agencies, we shouldn't underestimate the power of the community, and even if it's a community that looks very alien to us. And I think engaging as park managers or park programming people into the community of, say, this group that may or may not be homeless, but there is a community, and kind of hearing what the needs of the community are, you can program for that community. Fountain House has been programming for that community for 7 decades, and it's been a benefit to the city. Not just taking people off the street, but it is, currently a substantial portion of our membership are essential workers right now during the COVID-19, where the city benefits by the active engagement in these communities. It's not just solving a problem, but it's actually a benefit. And I think for public space, engaging in these communities can actually be a net gain. You're not just solving a problem. They are part of the solution to effective, vibrant, and successful public spaces if they're engaged properly.
Yeah, I agree with that. And just to add as well, as Elliot was saying, I think people go where they feel comfortable and where they feel safe. And that can be very different from neighborhood to neighborhood, just as I've seen in my time on outreach teams. But just on a concrete level, something that's very helpful and that everybody needs is access to bathrooms, which can be very hard to find in the city. And is particularly relevant at the moment in terms of being able to hand wash and things like that. But there are these basic concrete needs that everyone has. And especially at the moment, I know a lot of like the McDonald's or places that kind of fill in for that basic need are closed because of the stay-at-home orders. So yeah, water fountains, showers, bathrooms are just very helpful.
And power outlets and Wi-Fi too. Those are services that are available in parks, and those are things that people can't access anymore when even the restaurants and everything are closed. But I think that over time we've come to rely on our public park system to provide things that, as technology develops and as we become more and more reliant on different services that are available just in our daily life, we rely on parks increasingly to be able to provide those services. And when we don't have access to them, it's very easy to feel lost.
Yeah, we've heard this from many of our other partners. And obviously the need for a public restroom is a need that everybody has when they are in the public park. And it's kind of a hot topic for pretty much all public space managers and public space operators, because keeping a bathroom safe and clean is also not easy. But I think people have been very cognizant of all of these issues in the past. So let's jump to today. It's a really difficult situation. We are sheltering in place, or I know New York doesn't like to call that sheltering in place. We're staying at home, but obviously a lot of your clients and members don't have that option. So I am going to start with Elliot. Can you tell us a little bit about what has been happening with your members right now, and what is their experience, especially the more vulnerable of your members, who have housing issues. What is their experience with the stay-at-home order? And then we'll jump to community access. I assume you have a lot to say about that too.
We took an early decision that this was a life and death kind of moment for a lot of our members, specifically members that were in the shelter system, because we were unsure if the shelter systems would be able to put in proper physical distancing guidelines, and was even unsure what they were going to be able to do or offer if a substantial number of their staff got sick. So we took, for us in our 71 years, a kind of unprecedented move and offered alternative temporary housing. We have a farm that's 2.5 hours away from the city, 500-acre farm that can house up to 22 people. And we use that normally as part of our program. People go up there for a few days, and we offered that to people that were street homeless or in the shelter and didn't feel safe. And we've had a group up there this entire time taking care of the animals, but we knew they would be safe. We knew we could provide the protocols and the physical safety that we were unsure our street homeless or our sheltered homeless. We put out a call to our membership and asked if they would be willing to double up temporarily, take people into their own house to double up during this period of time, and members heeded that call. So as far as I know, every member that wanted to or felt unsafe, which was the vast majority, I think, of the street homeless and the people living in shelters, were able to find alternative housing. But you have to remember, we only serve about 2,200 people. It's a much smaller number than something like community access or something like that. So we had the luxury to be able to do this, and we had enough pre-planning to be able to do this. But that is not a solution. That is not a citywide solution, but it is the solution we decided to opt into.
Can you tell us what is happening with community access then? Because I guess you represent the people who are not as lucky to have Fountain House.
Yeah, and just to say, I think that's so lovely that you were able to offer that to those options to your members. So, it's been interesting in the city for folks on the street. When the situation first emerged, we were sort of researching and reaching out to see if new options were available for people to come inside. And we have seen that happen in some other cities, in San Francisco, Los Angeles, Philadelphia. There have been vacant hotels, for example, that have been converted into immediate spaces that street homeless folks could go. And, to the best of our knowledge, that hasn't been available in the city here. So the guidance hasn't changed. There are folks who are on the street. There are outreach teams who connect with them. But the outreach teams have reduced to what's been described as a skeleton crew. I think there's the difficult balance of obviously trying to keep staff healthy and safe, as well as participants healthy and safe, but also as a provider, trying not to bring a virus to somebody if you're running all over the city. So it's a very gray area of how to best keep people safe who are still on the street. But the philosophy has remained the same in the city, that people have a choice, so they can stay on the street or they can go into shelter. There's another option in the city for people who are chronically street homeless to go to safe havens. But there aren't many vacancies at the moment. So the options have been limited.
I would also point out, I think connectivity has been an important part because not everybody has taken advantage, even of, the very small number of people that we could help. But we did focus a lot on making sure that everybody had access to a phone and a smartphone, specifically if they felt they could use a smartphone. Not everybody feels comfortable using a smartphone, but making sure that we had a way, because we created a whole virtual clubhouse during COVID, but it's only useful if people have not only the physical phone, but also the service behind the phone. And we had to absorb all of those costs, but we were able to give out phones. We were able to get a whole bunch of phones before all the stores closed and get service for them. But I think that's a key, COVID or not. If you look at the amount of time outreach teams spend just trying to locate the people that they are working with, it is A, not very cost effective, and B, it doesn't serve the clients very well. And having just basic access to connectivity with all these amazing tools that have been developed, there's a huge digital divide that we need to really address, and some of it, and it often just comes down to cost. And it's a great way, if we can make sure every outreach team could give out a smartphone with unlimited data and with, service provided, that would make their lives a lot easier. And we need to find out as a community, as a city, how to fund something like that would be very effective, I think, along with the digital literacy skills to go along with it.
Yeah, and to that point, the intensive mobile treatment team, and I know Beth's ACT team as well, have been trying to distribute phones from when this situation started, as well as maintaining, weekly outreach attempts, but trying to really stay in touch by phone and provide education around ways to stay healthy and safe.
Beth, can you talk about telehealth? And I know that our kind of we'd always get bombarded by entrepreneurs and startup companies saying that they had these tools to use, and we always found it was not really connecting to the folks that we worked with.
Yeah, so similar to what Elliot and Courtney were saying, we're distributing phones right now, and assertive community treatment is a Medicaid billable program. So we have this twofold, balance with how we normally provide services and how we might normally engage with people, which would be face-to-face. And now we're adjusting to providing the same services, but over the phone. And the first step in that is making sure everybody has a phone and knows how to use it, and that they have a safe place to store it. If they're homeless or on the street, do they have, we've worked with people that have systems for certain rocks in the park where they're storing things. Do they have a bag that they can carry with them to maintain their phone? And with telehealth services now that are being provided, there's some people that prefer video, so we can still kind of do a face-to-face thing with somebody and using apps like WhatsApp. And then there's just regular telephonic outreach where community access has been developing guidance in our training department about how to extend a conversation and how to really engage with people effectively over the phone if you're maybe not used to having a clinical focused conversation with somebody over the phone. And providing those health screenings that if we're concerned that people are vulnerable to COVID and experiencing symptoms, then is the person aware? And we make that part of our every telephonic outreach with somebody is doing a symptom check and asking, have you felt feverish in the last 3 days? Have you developed a new cough? are you experiencing any shortness of breath, and trying to do those medical, as non-medical professionals, I'm a social worker, but trying to do those basic levels of medical evaluation to determine whether or not somebody might be experiencing or entering a medical crisis. And part of the conversation we're trying to have with people is that we're here to advocate for you, even if we're not seeing you face to face. And if you are starting to develop symptoms, we want to be able to make sure that you're accessing medical care and you're being treated with respect in the hospitals and in the clinics, and people are taking your concerns seriously. That, statistically, people of color are receiving less medical support. People of color are dying from this more frequently. And that's co-occurring morbidities as well with other health conditions that are also products of our racist social system. But in general, the telephonic services that we're providing, we're trying to make sure that there is an element of medical evaluation as well with the majority of them.
I want to talk to the kind of public space managers again. This is something that you could be really crucial in doing, is, for example, phones, being able to charge phones, but also being able to keep the phone somewhere overnight that's safe. A lot of our folks don't feel that they have a place. The shelter may not be safe for a phone, or sleeping on the subway may not be safe. And just having something as simple that's as cheap as, a $50 locker thing that you can store 100 cell phones, whether you're a businessman that just wants to leave it there for lunch because you don't want to look at it, or you're our folks. That is something, in having charging stations, these are something that's a public good, but would disproportionately affect the folks that are most vulnerable, that don't have a safe place to leave their phone to charge. And I think these are the kind of simple things that it's a way to build really genuine good trust. It will also create a community around it that you will be able to engage in that community. I think it will make the outreach people's lives a lot easier. I think also with the telephonic, I think we could do more with push messaging and things like that if we had access, if we had enough of our people with phones, we could probably do a lot more around that. So I think this is an area where public space could become a public good, not just serving, or let's just put it this way, serving the most vulnerable people in a relatively simple way.
Yeah, thank you, Elliot. I mean, it seems like what helps people who are not homeless connect, phones and access to Wi-Fi and a computer, those are the same things that help people who are homeless and vulnerable as well. It's just that with the vulnerable populations, there's additional supports that are needed in terms of literacy, computer literacy, being able to store or charge your phone. So these are all really good comments and good points for us to be aware of. I have kind of a follow-up question. So we talked about how you connect to folks today. Are people still congregating in streets and parks in New York, as far as you know, since New York City parks are open to the public at this point, but social distancing is required? But playgrounds closed earlier this month. I know the city went on a big sort of binge removing basketball hoops to minimize the basketball games in the city. So there has been extra efforts, and I know even from our neighborhood here in Jackson Heights that basically the playgrounds are a no-go. The play facilities where a lot of people used to congregate and hang out are a no-go. So where are the people that you are contacting and supporting and working with? Are they still in streets and parks? And we don't need to know about each and every hotspot, but if there is any comments about that, I think that would be interesting to our audiences.
Just for whatever reason, at the moment, the intensive mobile treatment team doesn't have folks who stay in the parks per se. We have folks who stay on the sidewalk. So we don't happen to go into the parks that much. But our street homeless folks are still on the sidewalk.
So streets and sidewalks are
Yeah.
the public spaces where we would find people the most.
But I mean, just coincidentally on our team, I have a feeling that homeless folks sleep in the park are still sleeping in the park, but I'll let other people answer that part.
And over on the Shelter Act side, shelter assertive community treatment, some of our street homeless individuals that do bed down in parks, they've been harder to find lately. So the parks aren't necessarily more or less populated than usual, but we're having a harder time connecting with our folks that are primarily living in parks because the food carts are gone and the restaurants are closed, and it's harder for people to access food in the ways that they normally do. So they're traveling further, and your geographic daily living space is just larger. You know, so with the reduced support from street outreach coming to the parks, and with us having a harder time finding people, they're getting less support than they normally do. So we're not seeing, I don't think, any increase or decrease in the use of parks in the places where our folks sleep. You know, we're not going to be finding people primarily that are sleeping in the maybe in the baseball diamonds in Central Park that have people perusing them frequently, but the parks where our people are more likely to be found have seeming the same level of foot traffic, but just less resources lately.
Yeah. So where people are, do you see that as people needing to travel further for resources, for food and restroom and so on?
Yes, that there's fewer people around to, you know, people are panhandling as their primary source of income, and there's not as many pedestrians. Then people are having to travel to different areas to try to get income. You know, we have a couple people that normally they have restaurants that would give them food on a regular basis, and those restaurants are closed, so they're traveling elsewhere, and we don't necessarily know where they're going.
Yeah, and this point kind of connects to earlier things that were said as well in terms of connectivity, information, and what resources are available. I know some of our folks on the street, there are a lot of rumors that are going around in terms of police forcing people off the street or the city forcing people into shelter, which is not the case. But nonetheless, you know, some of our folks have traveled 70 blocks because they were going to cross the bridge and go to New Jersey. So again, you know, that goes back to the need to connect and try to provide the education that we're aware of. Yeah, there are a number of factors pushing people around.
Well, that's a good point, and that was actually my next question. I know there's been a lot of rumors flying around, even for those of us who are very well connected and we're getting our news from hopefully proper news sources, but also from Twitter and Instagram and wherever else. So what do you know of what is the city's strategy for addressing the needs of people experiencing homelessness at the moment, if you're aware of that? And are your clients and the folks you're trying to help aware of what is available to them?
So, you know, for folks on the street, the city hasn't changed its guidance. Those are the same options that there have been in the past, which is the option to go into DHS shelter, or if eligible, into the safe havens, which is sort of a alternative to shelter. But my understanding is there's not a lot of vacancies in the safe havens, and people who don't go to shelter don't go for a reason and may still not be interested. So yeah, the city has not, to my knowledge, provided new resources.
Elena, the only thing I've heard is that if people are in shelters and they're over 70, they're starting to move them into, I think, hotels. Or if they're tested positive or they have symptoms. So there's people living like out in, of course they're not in Midtown Manhattan. They're out in some distant by the airport someplace in a room, and somebody comes and leaves a plate of food 3 times a day in front of the door.
Yeah, I was going to ask about that because there was an article, I believe, in maybe Gothamist or one of the relatively well-read online newspapers about the isolation hotels and interviews with folks who were placed in essentially isolation because they tested positive. So I just had I was wondering, do you feel that strategy is helpful? How are people, to your knowledge, doing in those kind of conditions? And that's also a question to Elliot. We know that everybody is on edge and people are, stressed and full of anxiety. And I'm assuming folks with mental illness are even more vulnerable right now. So any comments on that?
Well, I mean, our people are fairly well connected in the sense that they already had a community and the community remains intact and they're able to communicate regularly and participate regularly in that community. I would imagine that as our community, the larger kind of New York, your working community, your school community has been radically disrupted by COVID-19. I would imagine a lot of our street homeless folks, if they were still on the street, would find their communities radically disrupted. And they are just as dependent on their communities for mental health, but also physical health, money, access to information, all these kind of things that I think we underestimate, that we assume homeless people are these like individuals not connected to larger society, completely isolated, especially the folks I work with, the mentally ill. But you'll find that there's still a community. I think, somebody was talking about connected to the restaurant that's giving them food or the place that lets them use the bathroom. But that's a real connection. That's a real community that they have stitched together. And I think there hasn't been enough attention on what happens when you disrupt a community of precarious people that have been able to kind of basically hold it together because of this community, and you disrupt that. And whether you're talking people with substance abuse or whatever, there are these communities that have been completely disruptive. And I don't think we know enough as practitioners what to do in those situations, because I don't think this is fairly unprecedented, this level of
Disruption.
Citywide disruption. Usually it's targeted. They go in, clean out an area, try to disrupt, but that community can very easily reform somewhere else. This is a much larger disruption. I don't know the answer, but I think community access would probably have a better understanding of that.
I just to say from the IMT perspective, my understanding of these isolation units is that they're accessed through the shelter system. And so that's not available for people who are on the street.
Yeah, just in my experience, Courtney's right that in order to have access to one of the isolation beds, you have to already be a resident of a DHS shelter and have received a positive COVID diagnosis. In the mental health shelters that we're working with, asking the shelters to identify an isolation room in the shelter. And for a lot of shelters, this means repurposing an activity room or repurposing a staff office. And that might mean losing other types of service that, speaking to the point of maintaining community and connection, this might be a way that community is being lost and connections to others are being lost, that spaces that are already limited and taxed are having to be repurposed for this. And then in the shelters where there isn't the space available to create an isolation dorm or an isolation room, then people are being transferred. But DHS hasn't publicly shared what those locations are. So it's a little bit hard as a service provider to be able to know where somebody might be transferred to, and to be managing that fear that the person might have if they've received a diagnosis and they're already connected with the shelter. They might not know where they're going or when they're coming back, or are they going to hold my property while I'm gone? So it's a lot of fear for people.
Yeah, it seems like it's a really disruptive situation. Do you have any comments on kind of the disruption of the social ecosystems that support people, precarious people, whether they're living on the street or in shelter? I know our urban audience probably is very curious to learn more about it, and this is not necessarily the place for it, but I mean, even for us in our daily lives, the store is closed, the bakery is closed, the restaurant you go to is no longer open right now. Do you have any comments on how the sort of social and exchange relations may or may not be disrupted that support precarious people?
Well, one disruption that affected Fountain House is that we had a number of peers that were working on a pilot project doing peer support. So Fountain House members going to shelters, working with people one-on-one that had a mental health diagnosis to try to connect them to services, not necessarily Fountain House, but often Fountain House, but just working with somebody that had been in the shelter system, had a psychiatric diagnosis, and could work with you while you were going through the stressful time of being in the shelter. It's very stressful for many people. And COVID disrupted that because I think probably rightfully so, the shelters wanted to limit the number of outside people accessing the facility for the fear of spreading the virus, which I understand, but that was for those people that got a lot out of that one-on-one peer work. That's a kind of a classic disruption, and we don't know when we'll be able to do that again. Most of them don't have phones, so it is a real disruption, and we don't know if they'll still be there when we are allowed to come back into those shelters. Same with the soup kitchens. We have a fairly large presence of peers and some staff working in soup kitchens to connect with people. And obviously a lot of all the soup kitchens have shut down, I believe, at this point. But even before they'd shut down, they were reducing. And that's a major disruption. It's moved to a food pantry system, but they're trying to limit the number and the access. And it's not a place you could sit and talk and work on things. So those are very minor, but I think there are probably greater disruptions too.
Well, they probably aggregate. So I wanted to open to some questions from our audience. We have an audience today, so I wanted to see if they have any questions.
Great, yeah. So we do have some good questions here. The first one I'll read out is, what actions or steps can the public take to aid the homeless during the pandemic?
Well, that's a good question. Yeah.
I mean, one simple thing that comes to mind is handing out hand sanitizer if you have it. Or masks.
Yeah.
I think supporting the community-based organizations that are doing this work in this time, and it's difficult, and they are frontline workers. And for I think almost all the agencies, the guidelines are not yet clear if they're going to be able to reimburse for all these costs, but they're still doing it because it's the right thing to do. There's going to be some economic hardship for these community-based organizations, I think, coming out of COVID-19.
I can't sew, but my sister can. So she made 50 masks that I'm going to deliver to Community Access tomorrow, because Beth, or you and Courtney can talk about the mask and just PPE, access to PPEs.
And
No,
then in
it's just
addition to the PPE, the other stuff, oh, sorry, Courtney, go ahead.
Yeah, the PPE has obviously been an issue. We've still been going out. We went out for a few weeks without anything. And, you know, again, that we're trying to not have staff all get sick at the same time and not be able to provide any services at the same time as not bringing any illness to people. So yeah, the distribution of PPE for participants who want and would use it, as well as for staff, is still really important.
But yeah, just meeting those other basic needs as well, that we've said a couple of times that programs like street outreach are limiting services, and people don't have access to the basic things that they need anymore, like food and place to charge your phone. And, you know, if you're somebody who walks around with portable battery chargers, or you have some to spare, you know, those are really valuable. Providing food to people and things that are shelf stable, things that can be stored. You know, hot meals are great, but things that can be kept for later in the day or the next morning. But I think really for us right now, so much is crisis management and thinking about safety and what does somebody need to be here tomorrow is really how we're providing our services, you know, rather than what is this long-term goal looking like for this person? What do they need today so that we can see them again tomorrow or next week? And those are definitely things that the public can do to support.
I guess as a general call out, you know, we're kind of even more so than usual reaching out to collateral supports, you know, and other providers who might also be connected to some of the people we work with, just to get as many eyes on a person as we can, you know, because our outreach is limited. And just the more time someone can see someone on the street and see that they're not coughing or don't have a fever, you know, the better. So I guess, you know, to the public in general, if you have thermometers to pass out, you know, I don't want to overcomplicate things, but just seeing that people are healthy and seeing that people know they can call 311 if they have a concern about COVID symptoms.
Juliet, do we have other questions?
We do. So with that, how can municipalities best respond and support the crisis being discussed here?
Courtney mentioned that some cities are opening up empty hotels for people. And I think so many things can be solved by having somebody live in someplace. All these things we talked about, access to a bathroom, access to food, access to healthcare, all begins when somebody has a roof over their heads. And with, you know, tens of thousands of empty rooms, this could be the beginning of a realization that, you know, solving homelessness really starts with getting people indoors.
Absolutely. And to add to that, I don't know if it's simpler or not, but again, Atlanta has put out these portable hand washing stations. You know, there's, I believe it's a minority, but there is a minority of folks on the street who aren't interested in coming inside. But to have the ability to still, you know, maintain the necessary hygiene is really important, and those portable sinks could be very helpful.
And there used to be a program that operated out of Brooklyn, and I don't think that they're operational anymore, but Courtney and I were talking about it earlier, that there were mobile vans. They look kind of like RV trucks that had showers and had sinks, and they would drive to locations like Port Authority and parks where lots of people live and offer those showering and hygiene services on a mobile basis. And, you know, really just for personal and public health, I think, you know, cities and municipalities really do need to be looking at the best way to promote hygiene, which should always be accessible. That's a human right, but especially right now during a public health crisis.
Yes, we know San Francisco used to have those, the mobile shower and personal hygiene, and I don't know if they're still operational right now. We can find out, but I wanted to chime in on the comment about the hotels. One of the sort of very polemic pieces that have been popping up in my feed, because I've been reading about this, is the whole, there was an article about Las Vegas and folks homeless people basically being designated a parking spot and made to sleep outdoors in a parking lot, and the sleeping spaces were marked off for social distancing in a city that has probably hundreds of thousands of vacant hotel rooms. So to me, it was like a lot of the comments on social media were also like, how is this happening and why is this happening? Any other questions, Juliet?
Yes, this will be our last question, and I think it builds nicely from the conversations that have been taking place. What can be learned and seen from the current situation that might help future policies and/or services that support those experiencing homelessness moving forward?
I'll just what Steve said,
No.
and
Yes, I have a couple thoughts.
sometimes it's really simple. You know, housing means having a roof. There are so many barriers, I think, sometimes that get in the way, and so many hoops people have to jump through to access housing, and it's not necessary for the great majority of people.
And I would say
we've
that
seen people will congregate. They'll go to McDonald's, they'll go to libraries, they'll go to places they feel safe. And our colleague, Elena and I were going to do a workshop in June. I don't know if that's going to happen, but on engagement. And people need a place to eat. And if it's a warm, inviting place, they'll come back. And if they come back, then you can start helping people think about moving into housing. And it's a big jump if you've been living homeless for years and years to think about living inside. And it takes some time. And having those kind of places where people can come and feel safe over a period of days and weeks can be very effective. So hopefully we'll get a chance to have that discussion later on. But some cities have been successful, both in the United States and overseas, in engaging with people and moving people from street homelessness into housing.
Elliot, did you want to say something?
I wanted to just say two things. One is, I think the urban municipalities that have to understand what a crucial function that groups like community access perform, not just for the people that they serve, but the city as a whole, because people that don't have homes don't necessarily mean they don't have potential. And we need these folks to be brought inside to participate in the community that is our city. And the first step for most of them is groups like community access that are trying to bring in these folks so that they can go to school and get work and be healthy and productive members. And I think that's the first thing communities have to know, that it's not just solving a problem. It is actually increasing the resiliency and the strength of our entire community. We need everybody, and we need everybody we can get to be working on the solution. And dovetailing with that is, I think, understanding and respecting these natural communities of precarious people, incredibly resourceful, incredibly resilient, architecture, police, you name it, have tried to break up these communities, yet they still exist with very little resources, and they're still providing a need in serving their constituents, the people. So to try to ignore that they exist instead of utilizing them and leveraging that, I think is a mistake. And I think there are ways that we can be smart and let the community help solve their own problem by allowing them space, giving them supports, and giving them the dignity to try to solve these problems, and maybe give them some more resources to try to solve those problems, as opposed to outside people trying to solve their problems for them. And I think I know community access has done a lot around this idea of self-determination and autonomy. I would like to see more organizations do that, and I think this is a place where public space managers and parks people and things like that can be really instrumental in helping move this forward and understanding the role of groups like community access. We don't do street outreach, but what that role is and how they can be helpful in this process.
Well, I want to thank all of you for being part of this conversation with us today. I hope it's not going to be the last one. And we're really, really grateful for your time. We're going to be sharing with this and with our audiences. And we think there is a lot of room to discuss, to think together, and to strategize. And there is skills from different fields that can be brought to this issue. And I feel as a public space professional and expert that up until recently, we were kind of only working with our own tools and being able to learn from social work and social services and really open the channels of communication and collaboration is the way forward, especially in a post-COVID world where the role of public space is probably going to be different and changing, and we're all anxious and wondering about what that role is going to be. So thank you all, and stay in touch.
All right. Bye.
Thank you, everybody.